Mother Knows Death, starring Nicole and Jemmy and Maria QK.
Hey guys, welcome to Mother Knows Death. We have some exciting news for you in addition to the episodes that we normally do every week, which is pathology in the news and our external exams. We're going to throw in a little something different from time to time that we call 6 shocking stories.
Yeah, I'm sure we'll mess that up. That's
I know. This is the first time I actually said it out loud and I'm like, But so we thought since the news, we're getting such great feedback about the stories that we're covering in the news, we thought about all of the awesome stories that we have in the gross room that have been happening over years. And these stories have awesome videos and awesome pictures that go along with it. So we thought we would tell you about some of these stories. And then if you are interested, you could go to the gross room and see the photos or videos that go along with these cases.
Yeah, so we'll start off every story and say what the title of it is. When we get to the end of the episode, we're actually going to ask you guys for some of your submissions as well. We constantly are getting emails and messages with like some of the most outrageous stories ever. And it's something that we read to each other. So we'd like the opportunity to include them on here too. If you want them read aloud or if you want them posted in the gross room too with some pictures, if you have any of that. So we're trying to, hope this episode is kind of a fun new spin on older cases that aren't really relevant necessarily right now. And then feature your guys' stories as well.
Okay, so let's get started with the first story this week.
All right, so first you want to tell everybody what this one is called.
This one is called Lobster Claw. So you guys will get to see that my gross room titles are a little, sometimes they give a little insight into like what's happening inside of the post, but also they're play on words, or I like to make kind of quirky titles to have you thinking like, what could this possibly be about?
So it's the 1st of July. So 4th of July is coming up this Thursday. And we thought the best story to start this off with would be one about fireworks. So I don't know about you, because like I feel like I had a really sheltered upbringing thanks to you, but I don't really remember anybody playing with fireworks. We also all know that I'm a rule follower, so it's not something I would be attracted to going towards. And being in New Jersey, fireworks aren't really that easy to acquire. So do you have any stories of people playing with them growing up?
I don't know why you don't remember people playing with fireworks, because your Uncle Louie or my brother was known for, on our way to Disney World, stopping at, south of the border or something and getting fireworks and bringing them home and putting them off in the yard. And my mom let him when he was like 10 or 12 years old, by the way. So these are prime candidates of these kinds of stories that we're talking about as my own family.
Yeah, I mean, maybe I was just too little to remember. I don't have any memories like in our backyard growing up of anybody playing with them or any of my friends that I knew playing with them.
Yeah, because I probably, when Louie was in the backyard doing it, I probably had you on the opposite side of the house because I didn't want you to get blown up or something.
Yeah, so and then like fast forward, I'm not a teenager necessarily. I was 19 years old and I moved into the city, and then suddenly like everybody on every single block in South Philly is setting them off at all times all summer long. And then I start making friends in the city, and then I'm at barbecues where people are drinking and they're setting them off, and I'm just like, I don't want to be anywhere near this scene. So basically what's going on is similar in this story, where this guy and his friends are just hanging out, they're drinking alcohol. His sister, is like done for the night, and she goes in the house and even says, don't do anything stupid. And then they keep drinking more, and then, oh wait, let's pull out the fireworks. Nothing could possibly go wrong, right? So, this guy's like really drunk holding an M80 firework. It exploded in his hand, and then, key into the title of this article, which is Lobster Claw. I think you should explain what happened from there.
So this is kind of an outrageous video that we have here in the gross room of a guy who had this firework injury, as Maria is saying, and his hand literally looks like a lobster claw. It's like the 2 fingers, so his pinky and his ring finger are completely split in his hand from his middle finger and pointer finger. But the craziest part of the video is that he's still moving his hand. So it literally looks like a lobster claw. And the doctors were shocked that he still had movement in his hand. And they were actually able, in this case, they were able to repair it with only minimal tissue damage, and he was able to regain his function and motion back in his hand. It's one of the better stories of the stories in the gross room that end up leading in amputations and even death in some cases from fireworks. It's a very specific injury to males. 65% of these injuries occur in males. And in 2022, there were 11 people who died as a result of firework injuries, and these were people that didn't work in the industry. So a lot of the deaths are attributed to misfires, or like the product itself was just not good, which is also another situation because you're buying these things at a store legally and assuming that they're safe, and a lot of them are just not made according to the standards that they're supposed to be made. So even if you aren't totally wasted and lighting them off, you could still get injured by them. They're freaking dynamite, man. Like,
yeah, I mean, I feel like I'm just so not used to them being here. You know, when we're driving in other parts of the country, there's fireworks stores literally everywhere. They just aren't around like that here.
They're not, but now they sell them at Target and stuff. They never did in New Jersey, at least when I was a kid. But, and it sounds like you're like, okay, 11 people die a year. It's not that many people, right? But there's 10,000 plus injuries a year because of this. So even if you don't die, I mean, losing one or both of your hands or losing your eye or both of your eyes, it's seriously life altering. So these things are, the craziest part of this really is that with these statistics that I'm giving you, so we said 10,000 injuries a year approximately, right?
Yeah.
Over 7,000 injuries occur between June 17th and July 17th. 73% of the injuries occur this month, like that we're in right now.
Yeah.
So it's 100% surrounded by summer, 4th of July, that whole thing.
I was even hearing them last night. Like, in our area, we had these outrageous thunderstorms last night. So, you know, that was really all day yesterday. So thunder's going off and on all day. And then it finally cleared up at nighttime. And within 3 minutes of the storm ending yesterday, I heard them going off.
Yeah, it's definitely like a Saturday, Sunday thing. And it'll be happening like insane this week. So
yeah, so
we're definitely prepared. It never fails. So when I was working in surgical pathology, it never failed that, especially when I was working in a level 1 trauma center, it would be the day after 4th of July and we would get fingers in bags all of the time. Like, it's just never fail. And now we will get videos and lots of photographs to add. I mean, we have such a collection of cases in the gross room at this point of firework injuries because we get them every year.
So moral of the story, be careful with fireworks in general, but certainly don't be blackout drunk and handling or you're going to end up with a mangled hand. I really can't believe this guy didn't have worse problems or didn't have to lose his whole hand.
The video is just, it's so gnarly. Like, you just can't imagine, you know, being in that much pain and just being like, hey, doctor, look, I could still move my hand.
Does blow your mind, too, because you had your really bad finger cut 2 years ago. And remember, I cut my hand really bad a couple years ago, and they were like, if it went 1 more centimeter, you would have had, no function in your pointer finger anymore.
Yeah. That was a freaking horrible injury. Like, I still don't have feeling in my pinky. Like, even when I'm getting my nails done, it feels so gross.
So this next one's called Hug a Toilet. So this woman was 31 years old. She was living in a rural part of India. They didn't really have good sanitation there. There was no plumbing at all. So, you know, their bathrooms were essentially like an outhouse or a porta potty situation. She was bathing from local creek water, and then she was also making her own homemade pads that she was, you know, having her period, and then when she was done, she'd lay them out to dry until her next use. So what could possibly go wrong, right?
Yeah, so think about this. She was using a bathroom that was outside, that was essentially a hole in a ground that she was going to everybody was going into the bathroom. So you have, what do you have? You have flies. There's just feces that aren't getting flushed into public plumbing, so it's just sitting there, and it's exposing people not only to flies and stuff, but just to different viruses, bacteria. And when she was done with these sanitation napkins that she was making herself, she would lay them out to dry in this bathroom, like right next to all of this mess. So, okay, fast forward a couple months later, and she's experiencing, so she's married and she's experiencing vaginal itching and a white discharge. And you would think that you would not think of an STI or a sexually transmitted infection. 31-year-old woman with a white discharge and vaginal itching, like, what would you think?
I would just assume like a yeast infection or something.
Exactly, right? So she goes to the doctor and she gets a pelvic exam, and she doesn't have a yeast infection. In fact, she has a maggot infestation in her vagina.
So horrible.
It's so horrible. And when they were working her up and figuring out what the hell happened and how this happened, they got more of the story from her, and they assumed that because she was laying these sanitary napkins with the old blood next to the feces, that there were flies in the room and everything like that the flies were landing on the sanitary napkins, and they lay eggs and they're microscopic. Like, you wouldn't see it if you picked it up and looked at it. And she was using these pads right close to her vagina, and that is how she got the maggot infestation.
I talked about this in last week's episode too. I'm watching Deadwood, and anytime some medical situation happens, I'm like, thank God for modern medicine. It sounds so horrible to have to go through all of this stuff. So, I always think about that. I think something like a toilet is something we really take for granted, and same with, tampons and pads and everything we have. So reading stories like this just really makes me thankful to have access to these.
Well, so in the gross room, under the comments of this particular post that I did, a lot of people were like, oh, you need to look at open defecation on YouTube. There's these videos of look up poop beach. And it kind of opened my eyes to a lot of things that I didn't know were going on, especially in India, that people just go on the beach and are pooping, and it's like multiple people, like that's what they do. And when you don't have plumbing that's taking that poop away in a tube far away from people, and then you're sitting there, your water is right next to it. You're drinking the water that's contaminated. Food is contaminated. Animals are eating the grass that's right next to this stuff. And this is how people get these insane viral infections, bacterial infections, parasitic infections in these countries. And it's especially dangerous for young women, because when they have to go outside to either poop or pee, like think about this when you're going to bed at night, right? And you have to pee before you go to bed. Well, they don't want to go outside when it's pitch dark out, because there's an increased risk for sexual violence for them. They get, they're lifting up their dress and they're going to the bathroom outside and exposing their private parts. And the young girls are getting sexually molested. Older women are getting sexually assaulted. So this makes another problem, because these women now hold in their bathroom. So they hold in their poop or pee, and then they get urinary tract infections and constipation because they don't want to go outside to go to the bathroom when it's dark. It's just fucking terrible.
Yeah, I mean, it really is. It's really nuts. Like, I'm surprised. I don't know. I feel like a month is a really long time, but I'm assuming if they don't have great sanitation and everything there, that their doctors probably aren't readily available. So do you think she knew there was a problem at first, or do you think she just thought it was something like minuscule?
Well, I mean, she eventually went because the itching was probably out of control. And one interesting fact to know about how they treat these maggot infections, which is insane, is that they put turpentine oil on top of them, because what it does is it creates an environment that lacks oxygen, and it makes the maggots come to the surface and come out of the wound that they've created. It's so crazy, because sometimes if it goes really deep, they have to treat it several times in order to get rid of it. And
I mean, is this the only treatment for this? Because isn't turpentine really cancerous?
No, they also give medications as well. But for something like this, like, let's say, for example, a person has gangrene or something on their toe and they get maggots, because these, just like flies are attracted to poop, they're attracted to dead tissue, right? So they're attracted to a gangrenous toe that might just be like sitting out without a sock on. And sometimes people come into the hospital in America with like 1 or 2 maggots, okay? They could remove those and usually give them antibiotics or whatever and treat them and they're done with it. But in this case, this woman's were like deep in her vagina, like deep in an ulcer, and they weren't able to remove all of them just with forceps. So yeah, they had to use this.
And then is there the potential that they could like burrow through and go elsewhere in her body?
Yeah, I mean, they could. They don't really spread like that, like a parasitic infection would, like through the circulatory system or something like that. But yeah, I mean, we have cases in the gross room of this where it starts on a wound on someone's head and then it eats through their skull into their brain. Like, I mean, think about this. When a person decomposes, these are decomposers. They break down the tissue, they eat the dead tissue and help skeletonize a person. So they'll do it when you're alive too. If you have dead tissue that it's eating on, it's really gnarly.
Yeah, I can't believe that. So yeah, I can't believe it's from something like, you know, just a pad. You're just like trying to contain it, and then this is your only option, and then it goes this far. It sucks.
And you think about how shitty it is, like in America, having your period and stuff. I just like imagine we have things that we could throw out or cups that could grab stuff. Well, there's all different options, right? Like imagine having to use a piece of fabric that you have to clean and let out to dry that like other people have to look at and stuff.
Yeah.
It's just the whole situation is just so degrading. You know what I mean?
Do you think there's a possibility too that she was like, I know the case mentioned that she was bathing in like a creek water. Is there a possibility she was washing them in the creek water and the eggs came from there?
They think it's more likely because of the pad being around the fecal material like that. Just because it's out in the open in a room. Think about when we just had food out this weekend, right? We cooked like pork kebabs and some fruit and stuff for a barbecue we had this weekend, and like all the flies come, right?
Yeah.
They land on everything, and it's just easier that way. But yeah, I mean, you could catch stuff too from bathing in a creek. So it's just like, this is why young people die and people are so sick, and because of the way that these people are living. It's just really sad.
Yeah, for sure. So something we talk about a lot on here is rectal foreign bodies, and I think that concept in general is pretty shocking to some of our listeners because, you know, I don't know if you know this. So this show came out called White Lotus, and it's like, honestly, everybody was like buzzing about it, and I watched it, and it's really kind of a boring show. I really don't get the hype. But in season 1, there was this scene where like somebody was eating somebody else's butt. So like a sex scene, and everybody was clutching their pearls about it, and I'm just like, everybody just, I just don't understand what is so shocking about this, that this show's getting all this critical acclaim, which is why I feel like these rectal foreign body stories we cover are so popular, because people just can't fathom the idea of sticking something up your butt for sexual satisfaction.
Yeah, I think butthole pleasures is a very like frowned upon subject for people to talk about. But like, if we just make this normalized that like dudes like their prostate rubbed and the only way to really rub it good is to go in their ass, it just would make these stories not even happen. And really, I think that it would just make it so much less taboo. And if people did have a situation, they would feel comfortable going to the hospital. And I don't know. That's my personal feeling. I feel like I want to bring awareness to butthole pleasures, so we could just
because
we could all openly talk about it.
We also always talk about the concept that, you know, like there's always this, oh, I fell on it. Like, no, you didn't just fall on a shampoo bottle, dude. Like, you had to stick it up.
Yeah, and I think we have so many stories in the gross room of rectal foreign bodies. It's like we could probably do one a week for the next couple of years and still like not run out of material. And I think the most interesting part of it is that people, I mean, of course people use the standard dildos and everything like that, but people get really creative with what they're doing down
there. So I know you've explained this before, but can you give us like a brief reminder of why things can get stuck up there to the point of having to go to the emergency room? Like, why can't you just pull it out?
So, like I said, the prostate's up there, and think about that as being like a clitoris for a guy. Like
Yeah.
it just makes it extra special for a guy. And and think about this too. Like, let's say, because since we're gonna talk about butthole pleasures, we could just openly talk about the fact that like we poop, right? Like,
Yeah.
everybody poops. The book says.
Newsflash, we poop.
So sometimes like you feel like you have to poop, but then you're like, I don't feel like it. I'm too busy. I'm at the store, whatever. And you have this urge to go. And then all of a sudden, within like maybe 10 minutes, the feeling goes away, right? It's because the poop that's like the turtle head that's like pushing through is like, it gets sucked back up there, right? So you don't have that urgency anymore. The same thing happens if you stick something the opposite way up there, that it kind of sucks it up, and it could go to a point where you no longer are able to retrieve it yourself.
So how did they get it out at the hospital?
Well, different ways. They can manually extract it if it's small enough and if they could reach it. But sometimes they have to go in and make an incision in the abdomen and take it out through the colon. And sometimes they have to resect pieces of someone's colon. Yeah, it depends how large it is and how far up it goes.
All right, well, this guy was using a vibrator, not a shampoo bottle or, in your favorite story, a pear, and it got stuck up their butt. Nothing rare about this, as we've just discussed. The worst part is that, after it got stuck, they were obviously freaking out and trying to figure out how to get it out. So they took some salad tongs and stuck the tongs up there to try to get it out. And then the tongs got stuck as well.
Yeah, so he didn't go to the hospital with the initial rectal foreign body that was stuck, which was the vibrator, and then has to now, because you're embarrassed, and now has to show up at the emergency room with the vibrator in your ass and the salad tongs that got stuck up there too.
Think about what this car ride or the ambulance ride going to the emergency room is like with something stuck in your butt like that. Like, do you have to lay down in the back seat?
I don't know. Like, this is the biggest question I always have for people that work in the ER, because in surgical pathology, like, let's say for instance this happened at my hospital. We would get a bucket, a white bucket, and I would take off the lid. It would say rectal foreign body, and I would open it, and there would be a vibrator and tongs covered in shit, basically, right? I don't get any story except a piece of paper that says rectal foreign body. So I only have to imagine, like, what the hell happened? What is this? What's the story? I don't even see the imaging or the x-ray or anything, and I don't get a story. So that's why I'm so envious sometimes of people that work in the emergency room, because I have all these questions like, what did this person look like? How did this person come in? Were they, and we've asked this before. There's a combination of like, oh, the people come in and they laugh about it. They think it's funny and they're like, okay,
do you get dressed?
Yeah, well,
thinking of every situation.
And it's just like some people are kind of like, hey, I was playing around and it got stuck, whatever, haha. And then other ones are like, oh, yeah, like this vibrator was just sitting on the floor and I was helping my wife clean the house and I tripped and I fell on it. It was hers. And like these outrageous stories that you just know would never, ever happen in real life, right? And it's just the variation is very telling. And I think with my butthole campaign, my butthole pleasures campaign, I just think that like maybe I'm more for like they're going to get stuck either way. I know they make products that have like a wider base so they don't get stuck, but those ones get stuck too. I've seen those too. I just think that like I like the patient more that comes in and like laughs about it and is like, yeah, I was having fun and it got stuck or whatever, rather than like going in and trying to just make up some outrageous story, because I can't imagine like how mortified people feel,
They have to make ones that don't go up so far, right? Like how far
like
does
if
it have
it's attached to a person or a sex doll or like the wall. I'm telling you, because they make ones that have these like wider bases But like if you do that all the time, your asshole like spreads open pretty far. Like that whole thing could just go up there. I've seen them before.
But how far approximately do you think it has to go in? Because like if you're just having anal sex, that can't happen necessarily, right?
What? Well, the penis is attached to a person, dude.
I know, but I'm just saying, like,
well, how would? What are you talking about? How would it happen if it's attached to a person?
Because why couldn't it get stuck if it's attached to a person? If it could get stuck if it's not attached to a person?
Well, it can't because it's the person could pull it out.
Yeah, but why can't you just use your force to pull something else out?
Because you can't reach it up there. It gets stuck up there.
Okay.
That's why when you go to the hospital, like they have to, you have at the bottom of your rectum, right? Around your anus, you have a sphincter that's like a giant, like thick ass rubber band that stays closed all the time. So like right now, if I was like, I'm sure you have poop in your colon. If I was like poop, you couldn't just like push out
because
poop,
I'm
right?
envisioning in most of these cases, it's like partially sticking out and the suction is just so great that they can't get it out.
No. It's up there. Like, and then the
your
rubber
cheeks
band
can close around it.
The rubber band closes and is no longer open for business.
Okay.
And is like,
well, this is a
which
new
is why
visualization to me, because in my head for all these cases, it was like partially sticking out of the person. So that's why
so you think it was like clenched on it?
Yeah, like I'm imagining the suction is so great that's why they can't get it out. I didn't realize it's like fully inside in every single case.
No, it's fully inside.
Okay,
like, and that's why the guy was like, shit, I gotta get these tongs to like pull this out.
Well, this changes everything in my opinion. I just thought it was like partially sticking out, but the suction was so great that like no matter what force could get it out. So that's why I was asking if you're having anal sex, like why can't you just pull it out like the same?
No.
Okay.
It's in there and it's not coming back. Like it's just, yeah. So, well, this is good because now, like, if Maria doesn't realize this, then like nobody realizes this, right? Like, so the thing is that it's estimated from all of these studies that have been done and stuff from 2012 until 2021, 38,000, almost 39,000 people have went to the ER to get a rectal foreign body removed. And it's usually men. Sometimes it's women, but it's usually men because of the, like, if women had a clitoris inside of their ass too, it would be more common in women, but it's not. That's why it's more common in men.
I mean, now that I have this new information, I'm just about everything we've talked about before and it being fully in there, and it's like even worse visualization now.
Yeah, so I mean, it's not like this guy showed up at the ER with like a vibrator and salad tongs like half hanging out of their asshole.
That's what I thought.
No, it's like fully inside their body. Like if you looked at them, you would not be able to even tell that was inside their body.
This is blowing my mind because this is what I thought. That's why I was like, how do you even sit down in the car if these things are sticking out of your butt?
Well, I'm sure it still wouldn't be comfortable to sit down.
Assume not.
But yeah, that's why this case, I don't know if we said the name of it. It's called tossed salad. The x-ray is so striking because you could see the vibrator like totally in the abdomen along with the salad tongs around it. So it's a good story.
Oh my God. I'm seeing this in a whole new light now.
Oh my God.
I just assumed in every case they were like the pair. I don't know. Every single case, I just assumed they were partially sticking out and they just couldn't get it out.
No, what happened in the case with the pair? You know what? Let's save the pair for another episode.
You're right. Okay.
I know I've talked about it before, but like we can go into more detail with that. Let's get onto another male sexual pleasure.
All right, this one's called Dirty Job. So when we had Gabe on the podcast for his external exam, I was really trying to like put on my producer hat and be like, when people hear of firefighters, they think of fires. They don't really know like everything else you guys have to do. You know, like if somebody jumps off the bridge, you have to go scoop them out of the river. You have to go to car accidents. You have to save cats out of trees. Like nobody thinks more about what they do beyond fighting fires, right? So in this case, this guy comes home. He's intoxicated. He puts these 9 steel rings around his dick. I guess it helps with holding an erection for longer. Falls asleep. 3 hours later, wakes up with like intense swelling and pain. And then 9 hours after that, so we're now 12 hours after he initially puts these rings on, he has to go to the emergency room because he can't get them off.
Yeah, and again, that's like a common thing. Like guys with their junk, they're very like weird about it and get treatment and stuff. And so yeah, this is called a cock ring. Usually, I don't like using such vulgar words, but that's
Aren't they
that's
normally
what it's called.
like rubber?
So that's what you should get is the silicone ones,
Yeah.
because if there is a problem, they could easily be snipped off with a pair of scissors or something. But the metal ones probably work better because they're more rigid. And what it does is it increases sexual satisfaction. It could cause longer erections. It could cause a guy to last longer. So sometimes they put it at the base of their penis, or they even pull like their testicles through these rings, like this guy actually did in this case. So when you see the photo of it, it's like this engorged penis with like testicle, and just it looks like it's about to explode, and it looks so painful. And you know, you go to the hospital and you always think when you go to the hospital they're going to be able to help you with no matter what, but in this case they're like, we can't remove this, it's too thick of metal, we don't have the tools to do it. And they had to call the fire department to come remove it. And this legit happened, not to my husband, but to a fireman I know, had to do the same exact thing. So it happens, I wouldn't say it happens all the time, but it definitely happens. And in this particular case, they had to use a circular saw to cut through these metal rings because they were so thick. But then you go on with, well, okay, there's a patient with a very crucial, important penis right underneath of this, and putting a power tool next to it that could not only amputate the penis if it went through enough, but it also could create such like friction and heat that it could burn. And then you're heating up the metal at the same time while you're sawing it. So there's all these factors to take into consideration. And so what they did was they put a tongue depressor, or like a popsicle stick, underneath of the rings, and then they poured cold saline water while the firefighter was sawing the ring off of the guy.
I mean, this just has to be the unspoken side of firefighting, because, you know, every firefighter we know is not going to be like going around like, oh, listen to this awesome job I went to yesterday.
Oh, they probably hate it because they just can visualize the feeling. Like, apparently this guy was in so much pain, they had to give him opioid pain relief. And hopefully that kind of knocked him out, or made him kind of out of his mind, that he didn't realize that there was a fireman with a power tool at his dick. But
yeah, and how embarrassing. Like, what if this is in the town you live in, and then you have to see these people, and I don't know.
Yeah, I don't know. I mean, it's the thing is about the hospital is it's like we talk about all of these stories and stuff, and we, you know, we joke around about it, but we don't. When patients come in and stuff, it's like we just do our job, and that's it. And the ER people are the same way. Like you can't, like, if anybody says, "Oh, you guys are being insensitive" or whatever, it's just like you're not a human being then. Like, you can't have a person come in with a vibrator and salad tongs in their ass and not just be like, that's a little unusual. That's you know what I mean? Like, it's not.
Yeah, because I'm waiting for the comment on this that's like, you guys are kink shaming. Like, I'm not kink shaming anybody. I'm just saying be smart about
not at all. It's just
it.
not. It's not typical, and that's why we're talking about these stories, because we know a lot of you listeners are not typical. So we're just trying to save you, really. We're just trying to do a public service announcement.
Yeah,
here.
it's always the more you know. Like, now you know you can't stick certain things all the way up your butt, and you certainly can't stick salad tongs up there because they're going to get fully enclosed, like I've just learned myself. So everybody's learning every day, and that's the goal.
All right, let's talk about another kinky case.
This one's called Don't Judge a Dead Body by Its Penis. So basically, this 70-year-old man is just eating lunch, and then he starts having like coughing and difficulty breathing. Call 911. 911 shows up, and he's pronounced dead. So investigators start getting suspicious because when they're looking around his house, there's like these really pornographic pictures, and apparently this guy was known for these like crazy genital piercings.
Yeah, so they did the examination at autopsy. So just because he had this weird porn in his house and stuff, and he was known in the town to have crazy genital piercings, they started thinking that the case was suspicious, which I kind of feel like is judging someone for being kinky, right? Like, there's no other way you could die because you have these penis piercings, so it must be some weird shit, right?
Exactly.
So at autopsy, they examine him, and they are, like, I have pictures of the piercings, and they are outrageous. He's got things going in his urethra. His penis is cut in half on purpose. And a lot of people do these types of things. They put in jewelry, or they do this extreme body modification of splitting the penis in half because they think it helps give the urethra more of a sensual pleasures. Like, it makes the orgasms feel better and stuff. And other people just do it because they think like the jewelry looks good. Do you want to hear something actually fucked up? They do this in some cultures where they split the penis of young boys that are turning from like young boys to men. And if the boys like cry and show that they are not enjoying it, like it doesn't feel good and it's upsetting them, they're like not considered as much of a man as one that would just like sit there and take it.
This is absolutely ridiculous.
It is ridiculous, but like it's cultural, so we can't talk shit on it because it's just part of their culture. It's seen as a sign of fear in these children, so that's like a side note. But so at autopsy, they have this guy's penis, and they're really kind of like taking a lot of photos of it and dissecting it out to see like where this piercing goes and stuff. And I don't know, as a person that does autopsies, I'm kind of like, I don't really think that that's relevant to his cause of death. It didn't look like it was like massively infected, because like maybe if the patient died of sepsis or something, you would be like, so if a person has sepsis or like a widespread bacterial infection at autopsy, you would first backtrack and be like, okay, where did the infection start? So then you would like maybe look at some gnarly piercings in the penis and say, okay, that's where the infection started. Then that would be more necessary. But it didn't really seem to like have anything to do with his cause of death, according to like the symptoms that he presented with. So they do that. So that's the external exam, and you could see all these crazy body modifications he's done.
So basically,
to his
they're
penis.
spending a lot of time looking at his body modifications.
Yeah. So then they do the internal exam, and it's like bread and butter autopsy, clear cut. He has like pasta lodged inside of his trachea, and his cause of death was like bro choked on his pasta at lunch. It wasn't anything to do with his weird kinky sex life.
Yeah, like nothing nefarious, and like they just, were spending so much time looking at the other stuff that it was just the answer was in front of them the whole time.
Yeah. So it's still an interesting case, but it's also a lesson of like, you made this something that was nothing.
Yeah. I mean,
in my opinion.
I wondered, like, 70 years old. I just wonder, I feel like that's kind of older to have such an extreme modification like that. I wonder when it like got done, when he got it done.
Well, he was known in the town.
I wonder if for good or bad, like, what was he known for? Was it like,
well,
wow,
he was known for the penis piercings.
No, but
I don't know, like in reference to what.
Yeah, like was it like he has this done and it's like the most mind-blowing thing ever in a good way, or this guy's a freak, what's going on? I don't know.
Yeah, I don't know either.
This last one's called Sack of Potatoes, and this is going to be quite a journey. So an older man was living with his 45-year-old son who had a really long history of mental illness, from depression, bipolar, personality disorder. According to the family, he had been medicated for this for quite a long time and was seemingly normal, but clearly something was wrong because one night him and the dad got in a fight. They started fighting on the ground, and the son starts stabbing him with a butter knife and banging his head all along the ground. So they determined that the stab wound actually is what killed the guy, but you're saying that the head bangs could have happened before he died because of bruising?
Yeah, so in the photographs, there's a lot of bruising on the guy's head, or contusions, which is a fancy word for saying bruising, but that indicates that his heart was beating when he got those injuries. So it would have had to been either before the stab wounds or like as the guy was still dying, because his heart would have had to been beating in order to have contusions like that on his head. But it just shows that there was a lot of trauma. Like this kid really wanted to kill his dad. And that's a specific, when you kill either a daughter or a son kills their father, it's called patricide.
Yeah, that's really, I didn't know there was specific terms for it, so that's really interesting. And it does seem like a very passionate crime, with how involved it was with the stabbing, the headbanging, the fist fighting, and everything. So he then called his sister and his brother-in-law to say that it had been taken care of, and then went to a neighbor's house and was like waiting for them to answer the door, which how scary must that have been if you were the neighbor?
Yeah, we always hear cases of neighbors involved in these cases, just completely innocent people. But I believe the neighbor did know that there was something going on with those two, that they would hear them fighting. And so, sometimes the neighbors know, when you live close to your neighbors, they could hear things and things don't come as a shock to them.
Okay, so now get into the autopsy and what they saw with that.
So at autopsy, like Maria was saying, they saw contusions all over the guy's head because he was slamming his head on the ground. And he was stabbed at least 7 times in the abdomen with a butter knife, which you wouldn't think could do that. But I mean, anything could really impale a person and cause damage like that if you push it hard enough. And when they took out his aorta, they saw that there was a huge incision, which means that the aorta is the biggest artery in the body that brings all of the oxygenated blood all over the body. And when you put a hole in it, it will bleed. It will cause massive internal bleeding. So the guy died pretty fast after getting that injury. But the most shocking part was on the external exam. We always look inside of the mouth because we check the teeth, because that could tell you a lot about the person's history of like your dental health really tells a lot about your history, your health history. So we look at inside of the mouth, and when examiners looked inside of this guy's mouth, they saw this big piece of wood kind of a thing in his throat, like deep inside his throat, but it was sticking out. And when they took this item out of the mouth, do you want to tell them what it was?
A set of keys.
It was a set of keys that were shoved in his mouth.
That might be the most shocking part of this story for you, but mine is the conclusion of this, which is after this all went down, they determined that this guy was suffering from pretty intense schizophrenia, and he had been having like hallucinations. So they determined that during this fight, and what caused it was because he believed that this imposter had replaced his dad that was threatening him and his dad's life. So that's why he attacked this quote unquote imposter. And at some point that he perceived that this imposter was an inanimate object, such as a sack of potatoes.
Yeah, totally. He was diagnosed with schizoaffective disorder with acute paranoid delusion. And this was a case where they said that which I honestly, like, I kind of agree with this. Like, you want to be like, okay, this guy's a jerk, he killed his dad and this and that. But like, these are the reasons that there's these laws set in place for people that are dealing with mental health disorders and had like reasons of insanity, right? Like, this is why this was done.
Yeah.
And it's so scary to think that you could have a mental health disorder that would cause you to believe something like that a person that you love that raised you and stuff was not real and was possessed and
was a sack of potatoes trying to kill you and your father. Like, think about this really on the outside, like how ridiculous that statement is, but for these people, it's very real and true and causes them to do these crazy things.
Yeah, and I think a lot of it was just because he was like not taking his medications correct or correctly.
Yeah, so I guess the family came out and said that they believed he was on the medications and he seemed to be doing fine, but it seems like the day before the murder that the father had called the doctor and said he didn't think he was taking them correctly or was like skipping them. And as we all know with these psychiatric meds, you can't really just like skip one and then have one the next day. It messes everything up. So it seems like he was kind of just not on the right track, or nobody was monitoring him taking these drugs, and it just escalated into this really horrific scene.
Yeah, I wonder if anyone would ever be in a similar situation like this, where if there's some kind of protocol to making sure that these people take their medications. It's because once the person starts taking it, they feel normal. And then they even act normal to the people around them, and they just think, okay, they're taking their medicine and stuff. And it's so scary because I think that sometimes these medications could even make people worse in some situations if they're not taken correctly.
Yeah, agreed. So
it's a terrible story, but really, really shocking end.
well, if you guys have your own shocking stories, you could submit them to us. So we have a new email that you could send your story to. It is stories@motherknowsdeath.com. I'm also going to include that in the description of the episode so you can see where to email and, give us really good descriptors. Tell us everything from start to finish. If you want it featured in the gross room too, you could also send some pictures. We love seeing pictures and we would love to describe what's going on in them.
Well, that's the thing. Like we love hearing these stories, but I don't know about you, but I'm like, I need to know what that looks like. And that's why the gross room's so great, because you could really get a visual with all of these stories. And we are eventually going to make a tab in the gross room that has all of the stories that we talk about in this segment. So I think it'll be really easy for you guys to find it.
Yeah, so thank you guys so much. We will see you for our Pathology in the News episode in a couple days.
See ya! Thank you for listening to Mother Knows Death. As a reminder, my training is as a pathologist assistant. I have a master's level education and specialize in anatomy and pathology education. I am not a doctor and I have not diagnosed or treated anyone, dead or alive, without the assistance of a licensed medical doctor. This show, my website, and social media accounts are designed to educate and inform people based on my experience working in pathology so they can make healthier decisions regarding their life and well-being. Always remember that science is changing every day and the opinions expressed in this episode are based on my knowledge of those subjects at the time of publication. If you are having a medical problem, have a medical question, or are having a medical emergency, please contact your physician or visit an urgent care center, emergency room, or hospital. Please rate, review, and subscribe to Mother Knows Death on Apple, Spotify, YouTube, or anywhere you get podcasts. Thanks!